Good morning, friends. This is the recall question. An old man came with complaint of headache and gave a history of pre-auricular pain. Investigation. So the option is yes, sir. As in this question, you can see that old man. Through this scenario, we can understand that this is the case of most probably the diagnosis would be the temporal arteritis or Giant cell arteritis. So mostly patient would be the elderly man more than 50 years of the age, and in symptoms the new onset of headache, pre-auricular pain or temporal pain, often severe and localized. So with the temporal arteritis, and the other symptoms would be the jaw claudication, may not always be mentioned in the scenarios. VL disturbance can be there, which may lead to blindness if untreated. And other systemic symptoms, weight loss or fatigue, may be there with this scenario. So through this scenario, we can understand that this is the case of temporal arteritis or Giant cell arteritis. What could be the other differential diagnosis can come in the mind when we see that patient who's old and with the complaint of headache? So temporal arteritis would be the first differential, and other could be the tension headache, migraine, brain tumor, trigeminal neuralgia, temporomandibular joint dysfunction. So these all can be the differential. But here, as we can see that in the options, only ESR is given. So the ESR, if it is raised, mostly it would be the more than 50. So if ESR is more than 50, then we can think that this is the case of Giant cell arteritis or temporal arteritis. But in the exam, if it's asking the diagnostic investigation for this scenario would be the temporal RT biopsy. So if temporal RT biopsy is mentioned, then, and if the question is asking about the diagnostic investigation, then we have to choose the temporal RT biopsy, not ESR. But if initial investigation or a screening test is asking in the exam, then we will go with the ESR. So here only mention investigation. So these two things you have to keep in mind, that either it would be the ESR if initial screening or initial investigation is being asked. If diagnostic investigation, then we will choose the temporal artery biopsy. In a second question, a scenario was given with lab values of slight increase in calcium, high PTH, very high alkaline phosphatase, and ESR. What makes you distinguish between primary hyperparathyroidism and obstructive malignancy? So here in this question, the scenario was given with these lab values: increased calcium, increased PTH, very high alkaline phosphatase, and ESR. But question is, what makes you distinguish between primary hyperparathyroidism and obstructive malignancy? So the options are given: the elevated alkaline phosphatase and elevated ESR. So these two options they have given in this recall. So to understand this question, first we have to understand the what is primary hyperparathyroidism and what is obstructive malignancy. So in primary hyperparathyroidism, what happened because of adenoma of the parathyroid gland, which overactive, because of this overactive gland, parathyroid hormone increased, which increased the level of calcium, and alkaline phosphatase would also go high, but ESR usually would be normal. As you know that this parathyroid hormone is phosphate tracing hormone, so phosphate would be excreted in the urine, so that phosphate level in the blood would be low. So this is the primary hyperparathyroidism because of 80% more than 80% because of primary thyroid adenoma, which overactive the parathyroid gland and increase the secretion of the parathyroid hormone that leads to the high calcium and low phosphate, and alkaline phosphatase also will be the mildly increased, but ESR most probably it would be the in the normal range. And in obstructive malignancy, that could be because of skeletal metastasis or multiple myeloma or any malignancy which is obstructing the lumen, which cause the bone destruction or infiltration by the malignancy, increase the calcium, but parathyroid hormone will be either normal or low. As we understand that in primary hyperparathyroidism, parathyroid hormone will be high, but in obstructive malignancy, because of calcium is already there, so the parathyroid hormone either will be normal or it would be low. But alkaline phosphatase will be very high, and ESR also will be very high. So the as here is asking in the question that what makes you distinguish between primary hyperparathyroidism and obstructive malignancy. So the elevated alkaline phosphatase cannot differentiate between primary hyperparathyroidism and obstructive malignancy. Elevated ESR also cannot differentiate between the primary hyperparathyroidism and the obstructive malignancy, but PTH, parathyroid hormone, would differentiate between primary hyperparathyroidism and obstructive malignancy. So if we have to check the parathyroid hormone. If parathyroid hormone is high, it means this is the case of primary hyperparathyroidism. But if parathyroid hormone is low or normal, then we can say that this is the case of obstructive malignancy, not primary hyperparathyroidism. So keep in mind, this is the correct answer. Parathyroid hormone would distinguish between primary hyperparathyroidism and obstructive malignancy. So parathyroid hormone would be the correct answer. If it is high, it means this is because of primary hyperparathyroidism, as we read about the the parathyroid adenoma, which is 80% can cause primary hyperparathyroidism, and other 20% maybe carcinoma malignancy of the parathyroid can lead to the raised parathyroid. So parathyroid hormone would differentiate between primary hyperparathyroidism and obstructive malignancy. If it is high, it means this is the primary hyperparathyroidism, but if it is normal or low, it means this is the obstructive malignancy. Hope you understand this answer. Thank you very much.